OPES Health is a cutting-edge, multi-specialty healthcare facility in Tampa that is also offering alternative medicine. Here to explain is Director of Alternative Medicine and Weight Loss, Jeff Matthews. Good morning, Jeff. How are you?
Morning. Thanks for having me.
Okay, Jeff, I'm really excited you're here because we've been able to talk about OPES Health in the past. And I knew you guys did everything under the sun, but also alternative medicine. How is this fitting in?
Yes, we help everybody. And alternative medicine is what people don't like to talk about. Aging, hormones, weight loss, weight gain, vitality, libido, all the things that are hidden behind doors that nobody likes to talk about except to their doctor.
I was going to say, I think that's fair to say that people don't like talking about those topics, but this is something you guys are wanting people to come in and talk with you at OPES Health.
Yes.
Talk about when a patient comes in, or when does a patient know that maybe you're the guy that could help them out with some of their issues?
If they have signs just of aging, tiredness, weight gain, weight loss, cognitive thinking, just anything that they don't feel like they're normal anymore. We want everybody to feel like they're 25 again. And you were healthy at 25, you didn't get sick often, and it could be related to anything, hormones, balance in diet, and lifestyle. And we do both aspects, non-medical and medical, and try to get you back to feeling great.
I was going to say, okay, when you started with that list, Jeff, you're like, tired. What was all the other ones? I'm like, yes, yes, and yes.
Yeah.
When does a person know, though, that they really do have a problem and not just the regular symptoms that should come in and see you, spend time with you?
Well, if you have any symptoms, you should go see your doctor. And that's what, OPES Health, we have everything there. So we first do your blood work and make sure that everything's fine. Hormones are fine, your white blood cell, red blood cell count, you're healthy. And then if everything is good, we try to help you in lifestyle and diet.
We were talking before we started about that there is some controversy when it comes to especially like the hormones with weight loss. Talk about how you do have that two approach in case it's the hormone front or if it needs to be more on the medical front. You do it all.
Yes, yeah, we do it all. Hormones are very controversial. You'll see steroids, growth hormone in the news. Unfortunately, in the medical industry, steroids is just a classification of a drug. And so we do both hormone, which is bioidentical hormone replacement therapy, or natural. If you do not need hormones, we do natural alternatives also. And that's why we're classified as alternative medicine.
I'm curious, if someone does come to you and think that they have some of these symptoms, when you do the blood test first, are you able to, is there an umbrella treatment that you have that people do, or is it individualized care that you're able to provide at OPES? Actually,
it's individual. We would do it specifically for the person or the individual, male and female, because we both have issues. Even with females have menopause, and there's several stages of menopause, and men have andropause. So if they're scared and think that they're, having symptoms and don't want to talk to anybody, they can come talk to us, and we know it all.
And I want to definitely talk about the weight management aspect of this and how people, if they are, trying to lose weight and haven't had luck, is that where you would come in?
Yes. On the weight loss portion of OPES, we do both medical and non-medical also. Drugs aren't the answer to everything. So we actually will work with a patient or a client with their diet, their lifestyle, look at their blood work also, and it could be anywhere from blood type dieting to pH balance, or it could be diabetes. You never know, and that's why we do blood work. And hormones have a tendency to make people gain weight or lose weight.
Well, and of course, like just talking with you, the first thing that comes to my mind is the financial cost. So how does that work when people do go to OPES Health for this? The startup fees, all of that?
Actually, if the watchers of this show, the viewers of this show, come in and mention us, that they saw us on the Morning Blend, we're going to waive all startup cost. And we budget it to everybody. We will meet their needs.
I'll say, and meet the needs of Morning Blend. I just want to point that out there again, because that's a pretty great special offer. If you do mention the Morning Blend, no startup fee for any of the alternative medicine services from $200. Can't beat that. Again, OPES Health channel side, there's the address and phone number on your screen, and of course the website if you want more information. Thank you so much for coming on and talking about this today.